Good afternoon and welcome to Magic 95.9's Facebook Live with GBMC. I'm April Watts, your midday host with Magic 95.9, and joining me is now, you're like my friend now.
I know. I was like, I get to be with April again.
Yes, I love her so much. Dr. Betsy Dovec, and she is a bariatric surgeon and medical director at GBMC's Comprehensive Obesity Management Program. So how have you been?
I have been great. Life has been good. How have you been?
I've been awesome, but I've been stalking your Instagram. You are amazing and you are changing people's lives, and that's what we're going to talk about today. It's a new year, and for a lot of people, I hate to say resolutions, but a lot of people like to make lifestyle changes in the new year, and one of those things for a lot of people, especially lots of Americans, tends to be weight loss.
Absolutely.
Okay, so we have plenty of people that have had so many questions about this topic. Let's start with the first question. What makes a patient get started with your office with bariatric surgery?
So it's so interesting to me that the average patient who comes in to see us will try 22 different diets and exercise plans and maybe even a medication before they look into this.
Oh, wow.
So you know how it is. We've tried it. We've seen it all. We've tried it all. Some of it is downright dangerous, crazy. It's cost us a lot of money. So they do that first, and then they say, you know what, I still need help. The good news is weight loss surgery is the most effective tool that exists to help you lose weight. And so a patient will typically just surf the web and they'll come across us, or maybe they have a friend or family member that had weight loss surgery, and then they decide to look into it, and they end up on our website and they get started that way.
Let's talk about qualifications.
Okay.
Gina weighed in, and she wanted to know, is there a certain body weight that would bring someone into your office?
So the way that insurance qualifies you is based on BMI, which is your body mass index. And if your BMI is over 40, you qualify. Or if your BMI is between 35 and 39.9 and you have diabetes or sleep apnea or high cholesterol or high blood pressure, you qualify with those comorbidities as well. And the good thing is in Maryland here, all insurance companies recognize this as the most sustainable way to lose weight and keep it off. And so they pay for it. So the benefit is covered with most Maryland-based insurance plans.
Now, for those of you watching, you can feel free to chime in at any time because this is a conversation. We have plenty of questions that were previously asked by viewers, but you can chime in at any given time. Someone also wants to know, why do patients need surgery? Why can't they just do this diet and exercise?
Yeah, a lot of people think that this is the easy way out, or, you know, you do it the right way, the traditional way. The thing is, that just simply doesn't work a lot of times. It's a lot about the society that we live in. I know the last conversation we had was about sugar. Yes. And, you know, and its dangerous toxic effects. I mean, it is a drug and a very addictive one at that. And we all know it. We're all humans, and it's just everywhere. And I think that surgery has to be looked at as just a tool or as a part of the overall equation. Okay. So there's weight loss surgery, but you also need to change your relationship with food. You also have to incorporate getting more active. And then the most important thing, in my opinion, of that equation is to change your mindsets. You know, you have to establish why you want this, and you really need to change your habits and your lifestyle, as you already talked about, to be able to achieve that.
I want to talk about what you said about changing your relationship with food. And I think that that's very important, especially for African-American listeners and African-American viewers, because in African-American households, food is looked at as pleasure. Food is looked at as comfort. Food is looked at as love. And so, come on, I want you to eat. And because I love you, I'm piling on the macaroni and cheese. I'm piling on the pig's feet. I'm piling on all of these things that you probably should not be eating. So I just wanted to highlight that specifically for the Magic audience, changing your relationship with food. And that's something that I'm currently working on myself. So thank you for bringing that up.
Yeah, I think, you know, food, like you said, is everywhere. Some people use food to cope with when things are down, or maybe you have a desk job, you're bored, you're working from home, you nibble, nibble, nibble. Or, like you said, hey, maybe after church on Sunday, my family gets together, we eat. It just is sort of a way of life. And if I'm not eating, then I'm going to be the weird one. Yes. And it's not true, though. You have to somehow, you know, really be the brave one and go first and say, I want more than this meal. And it's not about this meal, it's about this company. And it's about the quality of the relationships that you're there to have that fun and that sort of thing. It's not about the food. And we have to change that thinking. And it is hard, but you're not being punished. In fact, this is something to do to get healthy.
Yes. Can you describe the metabolic changes that occur after having bariatric surgery?
So the reason why surgery works more than just diet and exercise alone is that, yes, we're making the stomach smaller, and I have props this time, so I'm going to show you a little bit about the surgeries that we do. But more than that, it alters your hunger hormones. So for example, when I describe one of the surgeries called the sleeve gastrectomy, when I remove a portion of the stomach, it's actually a portion of the stomach that is responsible for making a hunger hormone called ghrelin. Ghrelin is what tells your brain to eat more, eat more, eat more. So whenever I remove that, that will actually cut that signal to your brain so that your appetite will be greatly suppressed with smaller amounts of food.
Oh.
And so you won't have that overwhelming drive to eat, eat, eat. That's one great thing that happens. The other metabolic change that happens is that your taste receptors almost immediately after the surgery will change to the point where things will be way too sweet. So even something like Crystal Light that has no calories, no sugar added, and no carbs will be just too much, and patients will even water it down.
Oh, wow.
And so therefore, the cravings will minimize. They'll get away from their sugar addiction. The key thing, again, is how do you make certain that you don't go back to that addiction? And those are just some of the metabolic changes that makes surgery 85% effective versus diet and exercise, which is only 5% effective.
I think I need that. Can you take my thingy out so it'll change my taste receptors?
I know. Sometimes I think, oh my goodness, can they change the qualifications? Because this is my life's work, but I believe in it. And I think we all need it. I could get into evolution, my thoughts on why we all should have the anatomy that maybe is altered with this, but I really, truly mean that.
You mentioned surgical options. Can we get into that a little deeper now? What are the different surgical options?
So this is what everyone's stomach looks like before surgery.
Okay.
So people are always surprised to see that the stomach is the place where food goes after you swallow it. It goes into your esophagus, and then it goes into the stomach. The stomach has a really large storage capacity because I feel that, for the majority of civilization, we are hunters and gatherers, and we needed that. And so the stomach size, I would estimate it to be, when you're full, about the size of a football. So it's bigger than you would think. And it doesn't really matter if you're a man or a woman or tall or short. Everyone's stomach is roughly that size when they're an adult. Now, the first surgery I'm going to review is a surgery called the sleeve gastrectomy. This surgery has really gained a lot of popularity within the last few years. And what happens here is that stomach goes from the size of a football just down to the size of a garden hose. So the new stomach is only going to be roughly 15 to 20% of the size that it is now. So it's not like the lap band. There's no foreign object. There's no sleeve device. It just means that your new stomach is a sleeve or a sliver of what it once was. And then I will actually remove 80% of the stomach by pulling it out through your belly button. So no one really has to know that you had this surgery. I really pride myself in keeping this cosmetic. So I will actually remove it through your belly button. So all you'll have is 2 pinky-sized incisions, real tiny.
Oh, wow.
It's laparoscopic. It's minimally invasive. April's liking this
That's
more audience. It is. Oh, Mindy's saying that we have a question.
We do. It's from Samantha, and she said, what should you do when you crave carbs?
So the biggest thing there is if you're craving carbs, you need to get into the habit of going for high protein options.
Okay.
So a perfect way of eating would be to eat breakfast, lunch, and dinner with no snacking, picking, grazing in between.
Okay.
And those 3 meals need to be focused around protein and eating protein first. Because when your diet is high in protein, you get filled up, you get satisfied, and it will minimize your necessity to I need something. And so skipping meals or starving yourself is more detrimental, I think, than overeating at points.
So what about the 5 mini meals that it's said that you're supposed to have for increased metabolism?
I think that's bogus. I think that the best way to eat is 3 times a day, and then just eliminate all of it in between, because you can out eat these things. It doesn't matter if I make your stomach this big. You can continuously graze and eat soft things that kind of go on through, or even drink your carbs and calories, which is always a no-no.
I want to bring it back to the surgical options.
You
talked about the sleeve, but what about the bypass? What is that?
So the bypass, everyone is always kind of confused by it. It got a bad rap, unfortunately. But the bypass, I think, is an awesome operation that's been around for decades and decades. What happens with this one is your stomach goes from the size of a football down to the size of a thumb. Okay. So your new stomach is only 5% of the size that it is now. Now, nothing is removed with this one, so I'm bypassing 95%. So the digestive juices go down like they always do, But when patients eat food, it goes down their esophagus into the little thumb-sized pouch directly down the small intestine. So food goes this way, juices go this way. It's called a root and Y because it looks like a Y connection here is where the juices are mixing up.
Okay.
So the bypass, great option, and there's several reasons why to pick one over the other and all that kind of stuff. But I leave it up to the patient to decide.
I'm looking at that sleeve like, wait a minute. We have another question.
We do. We actually have a lot of comments, a lot of people watching. Greg,
Hi, everyone.
Jessica, Earl, Amy, Samantha, Cody, Ann,
Cakes.
Deneen, Charlene, Jamie, Melissa.
Awesome.
Lots of people. So Melissa said team bypass. Charlene said team sleeve.
Oh, a little debate going on.
I like
know,
it.
I know.
We also have Jamie asking, is the surgery just for extremely obese people?
So that, I'm so glad, Jamie, that you brought that up. That is the number one question it should be, because it is completely a misconception that the only patients that qualify for weight loss surgery are the type that need to be cut out of a house, or the type that you see on My 600-Pound Life.
Right,
those
right.
extreme shows. Sure, that exists, and those patients need help. But believe it or not, the patients that qualify are not as big as you would really think. I mean, a BMI of 35 is basically like being about 75 pounds overweight, which is typically, if you're like a 5'5" female, somewhere along the lines of a weight of like 215 pounds or so qualifies, even if you have a comorbidity. So no, not just the extremely obese. There's a lot of different patients that qualify.
Someone here wants to know, what is a typical visit like to your program?
So the first time a patient comes in, it is a long appointment. It's almost 2 hours long that the patients meet, because we want to make certain that up front they know exactly what they're getting into. There's no hidden secrets or surprises. Here it is. So I really take a long time explaining some of the mental changes that have to occur, like we talked about. I talk about what insurance requires per their specific individual plan.
Okay.
I also review the surgeries. I talk about the pros, some of the potential risks, and then I meet privately with patients, because my favorite part in this whole thing is to really meet a patient where they're at, which is typically at a really sometimes low point for them to be able to come in and decide that they need weight loss surgery, and kind of say, you know, why did you come in here today? And tell me your story. Because even though I might do the same thing, it seems like over and over again, it never ceases to pull me in to hear someone's why.
Right.
And
that's very important.
it's so important to establish that, because not only do I need to know that and to meet the patient there, but I need to keep a patient focused on what brought you in, and don't lose sight of that, because it's easy to fall into old habits. But if you keep your eye on the prize, you're going to always be successful.
Right. How long does the surgery usually take?
A sleeve, your favorite here, takes me 20 minutes to perform. You'll be back in the operating room for a total of 45 minutes from coming in, going to sleep, waking up, and leaving.
Are you serious?
It's very straightforward. And a gastric bypass is also very straightforward. It's done, and it takes me about 1 hour to perform. And you'll be back in the operating room for about an hour and a half in total.
What is recovery like?
Recovery is not bad at all. In fact, all of our patients are required to walk around within 2 hours of the completion of the surgery.
Oh, wow.
So it's not that painful. It feels like gas pains, and everyone's had gas. It's like a pressure sensation. So the physical discomfort is not bad at all. Typically, patients will take an average of about 2 weeks off from work.
Okay.
But I've certainly done patients on Friday that go back on Monday, and I've also done some patients that take upwards of 6 weeks if they have more of an intense job. So it's all in what a patient wants. The harder thing is, and the thing that we want patients to focus on, is getting your protein and getting your fluids and really following our recommendations.
Good stuff. Now, earlier you spoke about the incisions for the sleeve being like very small and at the navel. What are incisions like for the bypass?
Same exact one. So if I lined everybody up, no one would know. So I go in the belly button with the gastric bypass as well, and then with both of them, you'll just have 2 little pinky-sized incisions out to the side that I really try to hide. So if women are wearing a bra or a sports bra, or men are wearing swim trunks, you're at the beach, I don't want anyone to be like, wonder what they had done, or like you've had surgery, and or even when you look in the mirror yourself after a shower or something, you know, I don't want you to be like, oh, there's the mark of shame. I try to hide it because I think that's so important. And my team in the operating room also really, encourages us all to keep it, as sleek and cosmetic as possible.
What about the hospital stay? How long is it? Is it outpatient, or do you have to stay for a couple days?
I'd say some patients actually leave the day of surgery, but for probably 95%, they'll leave the day after. So they'll spend 1 day in the hospital and they'll leave by noon the next day. As soon as they can drink and stay hydrated, they get to go home.
How much weight should a patient expect to lose?
So with the gastric bypass, patients will typically lose between 80 and 85% of their excess body weight. So the way we describe it is excess body weight means, like, let's say in a perfect world you should weigh 150, but let's say you weigh 250. That means on average with the bypass, for every 100 pounds you need to lose, you're probably going to lose on average 80 to 85 of those pounds.
That's good.
It's awesome. And then with the sleeve, you're probably going to lose around 60 to 70 pounds for every 100 pounds you need to lose. And as you'll see when I have some pictures here, there are patients who lose all 100% of their excess weight and get down to their ideal body weight and their goals.
And again, it's about the full picture
The
and
full
about
formula.
exercising and about eating right and all of that
Absolutely.
stuff.
The more you're on point with this, the better your results are going to be. And it works. Every patient's going to lose weight with it, but the amount that you lose and how you keep it off, it is truly up to you. This is just a tool. This is by no means the easy way out. Every patient who's watching who has had this operation will tell you they work hard and they have changed themselves. And I'm sure you're seeing a lot of comments about it right now, and I don't even have to see it.
This is so inspiring. Let's take some of those comments.
Yes, actually, someone mentioned that Dr. Dovec's fan club is clearly here
Aw.
watching. Some of the fan club.
Thank you so much.
I know there's many more than the people that are watching. Someone said Team Dovec, Body by Dovec.
Yes.
Brian said best program in the area. Dr. Dovec and her team saves lives and gives second chances.
Oh, wow.
And Melissa commented about the gas after surgery. She said once the gas is gone, it's great.
Yeah.
That's awesome. How can people follow you on Instagram to actually see the work that you do?
So on Instagram, I'm under the handle, I'm at Dr. Dr. Dovec, Dovec. So that's DRDOVEC. You can follow me on Instagram. And I'm also on Facebook as well. And you can certainly friend me. I even respond to messages to patients. Obviously, this is not a replacement for the office. So if it is a true medical emergency, please call 911. However, if you have, a question, even if I don't know you and you're just thinking about it and you want to learn more, I'm happy to help you walk through how to get started. You can message me, and my name on Facebook is Elizabeth Dovec. And I have like a split face, half office face and then half OR face.
What percentage of patients that get bariatric surgery gain the weight back?
So the national average is 15%. At our program,
That's a
our
low
results,
average.
it is low, but our whole goal, from the minute you meet me in that 2-hour appointment, we talk about how do we get that 15% to 0%.
Right.
At GBMC, we are completely overhauling the way that we take care of our patients. So in 2018, we're really changing it from just, focusing only really on the pre-op process and then, seeing them for, just routine visits afterwards to pre-op and post-op. Our dietitians are going to be probably some of the only ones in the area and in the country that are going to see patients every time they come in as a post-op. Because again, it's all about having the surgery, but then keeping it off. Maintaining it is everything. Because it is heartbreaking when you see a patient who has gained, their weight back, and it's like, now what? That does not mean that you should feel hopeless. There is still absolutely hope. We can help you with that. I think the psych component, we have some really great bariatric friendly therapists that we encourage all of our patients to see. Hey, all human beings should see a therapist. I really, really believe that. And I think it's a very underutilized, branch of medicine for sure. So we really have a comprehensive approach at our program, and we want patients to feel that.
I really, truly love that. Once again, if you have any questions or any comments, feel free to do so. We have some more comments right now, so let's get to them.
We do. Actually, one is Dr. Allison Wells, who's going to be sitting in this
Hi,
chair
Dr. Wells.
next
Oh, hi. There she is. Hi, Dr. Wells.
She'll be talking about, what will she be talking about? She works
The
with me
loose
closely.
skin, right?
Yes, about body
Allison, you're talking
contouring?
about body
Body
contouring
contouring.
after weight
Yep.
loss surgery? Yes,
Yep.
awesome.
I know she works closely with you, so.
So yeah, a lot of people want to know about the loose skin. Is that what her question's about?
Well, she just
Checked in
saying
and
such life-saving procedures, so she just wanted to check in and let us know that she's
Good
watching.
stuff.
We also, someone said Jamie loves your hair.
Okay, now Jamie, hi Jamie. He is Lifestyle of Hair on Instagram. He did my blowout. He's the Baltimore blowout
Aw,
king.
hi,
Jamie
Jamie.
Poole. He is at Usha's eyebrow salon, so you should check out Jamie if you want a good blowout. And I've been wearing a surgical cap all day, and it's still hanging in there. So thank you, Jamie.
Well, Jamie, I don't have anything to blow out, but should I decide to grow my hair?
You are growing
I'll
it more
come
than
see
the
you.
last time I saw
Yes,
you.
because I was bald before.
But you could pull it off. I told you, Jamie is the one that told me that you could.
Yeah, I love the bald. I may go back to it. But let's talk about this loose skin.
Yes.
What can be done? Because a lot of people who lose a large amount of weight have that loose skin that's just hanging there, and that can be something that 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 affect their self-esteem and how they view themselves.
Exactly. So the thing about the loose skin is I cannot predict what will happen to a patient and what will bother them because it is very subjective.
Yeah.
So there's different elasticity properties to the skin. So typically males, of course, men have more elasticity.
Yes.
Second thing
Lucky
is, of
so.
course, the younger, yes, exactly. The younger you are, the more elastic you are. You know, the younger you are, the less wrinkles you have.
Yeah.
And actually, African American skin has the best elasticity properties.
Woo-woo,
So if
we'll
you are a
take it.
young black male, you're going to get a six-pack. You're going to get ripped. And I actually have some pictures of some really good living proof of that. Us older white women, you might have some looser skin, but people like Allison Wells, Steve Rotman, there's quite a few plastic surgery surgeons in this area that really specialize and take awesome care of our patients. And really, I always feel like with weight loss surgery, they ran a marathon, except for they didn't finish that last point too. And sometimes they need just a little something to kind of pick up the sagginess and anything. We all kind of need that too, I think.
Yeah.
But yeah, they're really awesome at helping with that.
Okay, so here's my favorite part, and this will help out some of the negative Nancys who may be saying, this is too good to be true. Let's talk about success stories.
Yes. So I have a bunch of pictures. So I just want to tell you the last time I was on Facebook Live, we were talking about a reveal party that we do.
Okay.
So each year we do it around the holidays, and when we started we had a few people, but this past year we had 750 of our patients who came to it.
Wow.
It was one of the best nights of my life. It was a defining moment in my life and in my career. And it was just so moving. And what we had, we picked 18 people volunteered to show their before story very bravely, and then they walked the runway. And right now on the GBMC Facebook page, you can watch this. I have a 6-minute kind of video of their before and then them, and the confidence and their change.
That's
is just
so
incredible.
empowering.
So here are 9 of the patients, and this is their befores.
Okay.
And like I said, they all have their own stories. They all started out at different weights, different sizes, so no two stories are the same there.
Shall I zoom in a little bit? Okay.
Okay, so these are the same exact 9 people after.
The woman in the middle, oh my goodness.
Carmela, hello, yes.
And oh my goodness.
Ty, yes, Ty is amazing.
Let's kind of like try to
Yes.
do, I don't know how this is going to work. Here we go. This is before and this is after. Bring them in.
Scoop back.
Scoop back. Okay.
I know. Can you even believe it?
Incredible. Unbelievable.
They don't even look like the same person.
Wow.
And the craziest thing about it is most of these transformations happen within a year to a year and a half after surgery. It happens fast. So if you're contemplating and think that you're at the bottom of this huge mountain, just think in a year and a half from now, you're walking this runway.
Yeah.
It is you. I mean, here's the other 9 patients that did it. And I want you to pay particular attention to the bottom right-hand corner here.
Yes.
Raymond Campbell. He
looks like another person.
He does. He had some
totally
fun.
Different person.
He took off his shirt, so everyone, you should check it out. It was so fun on that video. He had some fun with it. And the crowd went wild. Like I said, it was just a magical night.
And you know what's interesting? I'm looking at these pictures, and I see people smiling in the before pictures, but in these pictures, I see truly happy people. They look happy, and they look confident, and that is a difference.
Yeah, that's so true to point that out. Even when I meet them and they come for their follow-up, it's the way even their voice sounds is different. And then I put this one on here. Here's a couple. We do a lot of couples. So we do sisters, we do husband and wife, we do partners, we do mother-daughters. You'd be shocked at all the different ones. Brian and Angie, amazing.
Wow.
And they're sort of our Facebook celebrities. I think Brian might have even commented. He might be watching. Yeah, and then this is another one from the reveal party. Sean, he lost over 200 on, I believe, 25 or 30 pounds.
Jeez.
Unbelievable. And then here's another one of Carmela that I have here.
She looks gorgeous.
I know. She is gorgeous. And and all these people are amazing human beings, and I feel like after this surgery, it gives them more of an opportunity to not be discriminated against because they might be perceived as lazy, or it pushes them to get that promotion at work, or to have children, start a family, watch your family. You know, all those reasons. You see this coming out in these people. So it's so much more than what the scale says in losing weight. It's everything.
It's really inside out, you know?
It is.
It
is.
really, truly is. How many weight loss surgeries are performed at GBMC each year?
So we are on track to do over 1,000 weight loss surgeries. So we have this thing called the loser's bench, which is when a patient, that's what they want to get on. They want to have the surgery, so they're now going to be on the loser's bench.
I like that.
And yeah, we have 1,000 patients that join that loser's bench every year between my partner, Dr. Gus Bello, and my other partner, Dr. Tim Fries, and there's 3 of us. And
good stuff.
We hustle hard, but it's the most meaningful work in the world, I think.
Good stuff. I do believe we have some comments.
We do. Melissa says it's the surgery is an amazing tool, but it is work. Thankfully,
Yes.
the GBMC comp program helps you if you do slip up. She's never fallen behind. Charlene says, I worked hard from a 26-28 to a 12-14 for over 3 years.
Congratulations.
Charlene.
That's a big deal.
Melissa agreed. Absolutely. The mental health part of this is absolutely key, especially for those of us that used food to self-medicate. Dr. Wells said, of course, it's post-bariatric body contouring, to answer our question from earlier. That's what she'll be talking about next month. Deneen says the Facebook support group is amazing as well. Anne says, always work in progress, but best decision I ever made.
That's great.
Amy said, it's so inspiring to see the change. Melissa said, I cried during the reveals. They are absolutely moving. Jill said she's walking in it this year. This year, she's going to be part of the reveal.
That's right, Jill.
BJ says, has a question. Can you have the sleeve done other than laparoscopically? Gosh, sorry.
No, there's really no reason you'd want that, because that would mean taking the incisions from little tiny incisions to a big, huge open incision. And I actually find it way easier technically to perform it through the little incisions, because I can get into tight spots. It's actually on all high definition screens. We would love to watch like a football game on this quality of image. It's magnified, it's high definition, and it's much easier on me and of course on the recovery.
And actually, she said her husband had an umbilical hernia repaired with mesh.
No problem at all. A lot of patients do.
Oh, okay.
So, yep, no problem at all. I might have to just move it up to Satites, but I can still do it through little incisions. So it might not pull the stomach out through the mesh, of course. I wouldn't want that to get infected, but I can adjust that, and so he would still be a candidate.
Okay.
You know your stuff too. Like you're just on
this
it.
is all
like
I do.
rapid fire. This is your thing. And
I did 4 of these puppies today. That's why I'm racing down the highway to get here.
Wow.
Yeah, I mean, this is what we do. We have an amazing team, and we're very well oiled, and we're very efficient, which is not saying that we do not rush, but we get stuff done, and if anything's slightly off, we all know it, and we all know what to do. So if you're looking for a program, you should come to one that this is all we do. This is all I do, is the same thing over and over, but that's great.
Somebody mentioned the comp program.
Yes.
What is that about? And talk about the resources that are available for patients.
Awesome. So at GBMC, we call our program COMP, which stands for Comprehensive Obesity Management Program.
Okay.
So we don't just say we're just a surgical option. We really focus on our amazing dietitians. We have Jana Wolf, who actually does a monthly special, just to pitch it real quick, called The Sleeved Chef, with one of our patients who's lost hundreds of pounds, who is a professional chef.
Oh.
And they do bariatric friendly cooking classes. So you have access to 2 dietitians and Jen Muller. We also have 2 medical assistants. We have 2 nurse practitioners, 3 surgeons, an insurance coordinator, a surgical scheduler, and then also our front desk staff to assist. So we have all that, and then we also have a very close relationship to therapists, like I said, such as Kelly Wallace. She's with Core Counseling, and she really gets it. And I think that's what you need. If you don't jive with your therapist, pick somebody else.
Pick
That's
a new
okay.
therapist. It's very simple. Pick a new therapist.
Exactly. And there's no harm in that. You need to have a good relationship so you feel comfortable and you want to keep that relationship going.
Do patients have to take supplements and vitamins for the rest of their lives?
Great question. They do, and I know that sometimes that's like, a lot. You have to take a multivitamin, 2 servings of a multivitamin, and it needs to contain folate, thiamine, and iron. With the multivitamin, even if you don't have surgery, I think that everybody should take one to cover anything that your diet does not. Okay. And then the second thing is calcium citrate with vitamin D3, and they do take that 3 times a day. But they're really good. The chews, I love them. I think everyone kind of makes fun of me because I'm always snacking on calcium citrate, because they're pretty good. So it's not that bad.
Okay, so you spoke earlier about patients possibly gaining weight back. What happens when patients gain the weight back? If you get a sleeve and your stomach is much smaller, does the stomach just stretch back out? Does it grow? How does that work?
No, the stomach does not stretch. That's another misconception. What happens is the stomach looks the same, but you might go back to those old habits. I think the biggest advice is do not drink things with carbs and added sugars. Do not drink sodas. Give up alcohol, especially with mixers. Give up fruit juices. Even though we think like orange juice, cranberry juice are so healthy, they're not. And then finally give up sports drinks. Gatorade, Powerade, they did great campaigns. These athletes,
sugary.
So sugary. Trust me, the athletes out there are not drinking the sugary Gatorades. They're not. No one is. And I think that's the biggest advice. And then the second advice is to avoid what I call the trifecta of doom, which is popcorn, chips, and pretzels. Oh no.
I love them all.
Oh no. No, we all. I know. People will tell me, I need that fizz, or I need that crunch, or I need that nibble. I need the salt.
I just ate popcorn today.
Popcorn disintegrates in your mouth. Next thing you know, you're at the movie theater like, oh, I just ate the whole tub and I'm not even full. It doesn't matter. Like I said, if I make your stomach super tiny, it disintegrates in your mouth. You're going to be able to eat a ton of it.
Right. This is true. Do we have more comments?
We do. Ebony says, thanks to Dr. Dovec, I've lost over 100 pounds.
Oh, that's awesome.
Amy said, the entire team rocks. Brian says, almost 2 years out and I can't even see the cuts that were used.
Good stuff.
She has magic hands, he says. And John actually asked the question about supplements. He said, what's the after surgery like, such as having to take supplements and vomiting, which you just addressed the supplements. Thomas said, I'm down 145 pounds in less than a year.
Go, Thomas. Ooh.
Yes.
Melissa said, I've only thrown up once, so to address the vomiting question, but that's after she ate something she knew she shouldn't have. She takes 2 chewable Flintstones a day and 3 calcium citrate a day, and they're so good.
They are good. I'm telling you. I'm not just saying that.
Someone, Thomas said Powerade Zero. I guess that's something that he takes.
Yep.
And yeah, that people are loving this. They're learning a lot, I think.
Oh, good. I hope that even if it inspires one person to kind of look a little deeper, because it's funny when I ask patients, how long did it take you until you decided to come here? They're like, well, I've been searching you for a couple years now. And it's funny. They know more about me through Googling than I know about myself. I'm like, oh, I didn't know you saw that. You're like, oh, yeah. They all piece it together.
Yep.
I have 2 kids. You're going to find this out. You're going to see I post about my kids a lot. And yeah, we all become a family. And guess what? I'm going to get to know you too. You know, I'm going to become friends with it.
So we have Joyceline who asked the question. She says, I am 5'4" and I've been about 240 pounds for about 18 years with several drastic attempts at weight loss, uncontrolled diabetes, chronic global body pain, on fentanyl, spinal issues, and in need of a knee replacement. I'm not very mobile. Am I a candidate for weight loss surgery?
Absolutely. You should see me first. You should see me before you keep going down procedure after procedure with the orthopedic surgeons. And the orthopedic surgeons would say the same thing. The results, the recovery, the therapy that you do is much better if you're down 100 pounds.
Right.
So I do patients all the time who are immobile, and then afterwards, I love it when they kick their wheelchairs to the curb and they're there walking, or even just walking with a cane instead of being, immobile. So absolutely you're a candidate. I hope to see you and meet you soon.
Who is just absolutely, strictly not a candidate for the weight loss surgery?
There's certain, we want to make, this is elective, so we want to make certain that it's safe. So sometimes if a patient has had multiple open heart surgeries and their cardiologist, for example, says, you know what, when you're weighing the risks and the benefits, I don't feel that this elective surgery you could safely get through.
Right.
Because it's not really so much what we do surgically in the abdomen, but it's more the stress on the heart and the lungs from the anesthesia and going under. So, and I encourage anybody ages 18 to 75, and even if you're over 75, I'd still probably look into you to see if you could safely get through it. I do all weights, I do all sizes, and as long as I do my due diligence on the back end and get all the clearances as appropriate, then if I can safely do it, I'm going to give you a chance.
Good stuff. Can people eat and drink after the surgery?
Absolutely. So it's also a misconception that if you go to a restaurant, you're going to look like the weird one. So you're going to eat normal foods. Like I said, it's centered around protein. You eat protein first. You eat small meals. You eat 3 meals, and that's how you do it. So you can go out. You can order off a menu. A lot of times patients will put most of it in a doggy bag to go home with before they don't even play, or they just eat an appetizer portion. So it's a lot cheaper. So you save money that way.
Right.
The hardest thing, I think, after surgery is we do tell patients not to eat and drink at the same time. So they need to separate that by 30 minutes before and after.
I see. Okay. That makes good sense. Do we have any more questions?
We do, yeah. John says he has went back and forth about the surgery several times. very scared, but has hypertension and type 2 diabetes. He said, is it a year-long process prior to surgery?
No. We are working very hard on all of our patients' behalf to make this become more like a 12-week process.
Okay.
We feel like some of the insurance mandated 6-month, 7-month, 12-month process. It's sort of like, gosh, I made up my mind. Finally, I'm here. I'm ready. And it's like, why do I have to wait? Like, what is that going to change? So my partner and I have really been going on the patient's behalf to the insurance companies. We feel that, yes, education is absolutely paramount, though. And we think that it can be accomplished in 12 weeks. So if you come
fair.
I think it's fair, too.
It's fair.
And we have some great ideas. So if you come and see us at our program, we're going to be talking about some online options to kind of fulfill that obligation, be educated at your own pace, at your own time, and when you're ready to do so. And then afterwards, you're going to have more of an in-person individual assessment with our nutrition on the other end of it.
Okay. Now, what about information sessions? Do you guys give those at GBMC?
Yes. So to get started, you go to gbmc.org/weight loss, all one word. And you can either do an online information session, or you can do one in person. So we offer them 3 to 4 times a month in person, or you can do it 24 hours a day online. As soon as you complete that, turn in your patient information, we'll schedule you for your initial consult, and I'll take it from there and explain what to do.
That is awesome. Is there anything else that you want the viewers to know before we close this up?
So I want you to know that weight loss surgery is not scary. It is, it's actually more dangerous to get in your car and drive to the appointment than it is to have surgery. And not only that, if you don't have surgery, the chances of you succumbing to the disease are higher than the risk of the surgery. And so I really think that I hope that you look into this. These stories motivate you. These are one of thousands. At GBMC Comp, we've done over 10,000 surgeries since it started over 14 years ago. And I hope that you could become one of the success stories as well. I believe in it. It's my life work, as well as my partners and our entire team. And we really do hope to see you soon.
And Dr. Dovec, you're such a rock star. The people don't want to let you go. We have another question.
This will be our last question, but I think it's a good place to end.
Okay.
Amy says, the body scan. Ask about the body scan.
Oh, okay. Yes. So yes. So like I was saying, that we are the first program in the country to really overhaul how we do it. So my partner, Dr. Bello, he has identified that the scale is garbage. I mean, the scale does not measure how you are, and your fat distribution really predicts how your risk of getting diabetes, cardiovascular problems. That central kind of distribution is way more dangerous than if you have more of a pear-shaped hips and butt distribution to your weight. So in our office, we have patients before surgery do a baseline 3D body scan. It takes thousands of measurements, and then it makes a kind of like claymation virtual image of yourself.
I want one.
You can come over. It's free. It's
I
free,
want
everybody.
one. Oh my goodness.
So you get on it, and then every time you come in at 8 weeks, at 6 months, at 1 year, and then annually, we get you back on there. And then your image, you can see to the millimeter how much you shrink. So it's much more accurate than just doing it with a tape measure.
That's awesome.
Yeah, and it shows you how and it superimposes your own little avatar onto itself, so you can see it side by side. So if, let's say you have a plateau and the scale doesn't move, but you can say, my goodness, I've lost 100 inches in total. I mean, I have a lot to celebrate and not dwell on something silly. Yes, exactly.
I have an idea. I think I should go to GBMC and we should do a Facebook Live of me getting a body scan. That's what I think. We should do that.
Yes.
Let's do it.
Yes.
Let's do it.
It's super simple. It only takes 1 minute. That's it. So you just ride around, and I would love to get it. And it gives you like a 13-page report.
Once again, can you please tell everybody how to follow you on Instagram and how to follow GBMC?
So on Instagram, I'm at Dr. Dovec. That's DRDOVEC. On Facebook, I am Elizabeth A. Dovec. And feel free to friend me and message me if you have any questions. You can also go to our website, which is www.gbmc.org/weight loss to get started with either an online or in-person information session.
And the next information session I'm reading is January 25th at 5:30 p.m.
Yes, that's on a Wednesday night. Come on out. Bring your friends, family, support. It's always better if you have somebody in there with you. But if not, just come in here and learn more about this. In addition to what we talked about, we talk about a lot more things. And like I said, I can't wait to meet you and see you soon.
Well, this is a wrap for today's Facebook Live, but be sure to tune in on February 15th at 3:15 p.m. We're going to be talking about options to deal with loose skin following weight loss surgery via body contouring with Dr. Allison Wells. See you next time.
Bye, everybody. Thank you.